Hello, my name is Dr. Dina Kentigan, and this lecture is entitled Integrative Health. By the end of this lecture, the learner will be able to define conventional, alternative, and integrative health, explain the 7 core areas of health, discuss the history of integrative health in the United States. Conventional medicine. Conventional medicine is the use of scientifically approved therapeutic systems and diagnostic methodology to treat illness. Some other terms used for conventional medicine include allopathic medicine, biomedicine, and Western medicine. Some examples of conventional medicine are medications, radiation, and surgery. Alternative medicine. Definition: treatments used instead of standard medical treatment. If a non-mainstream approach is used in place of conventional medicine, it's considered alternative. Complementary health or medicine. The definition generally refers to using a non-mainstream approach together with conventional medicine. An example would be using acupuncture to lessen the side effects of cancer treatment. Integrative health. The definition of integrative health is it combines complementary and conventional approaches in a coordinated fashion. This approach is evidence-based. The patient and the practitioner are partners. Integrative health addresses the mental, physical, spiritual, and community aspects of health. Effective interventions that are natural and less invasive should be used whenever possible. Integrative health aims for well-coordinated care among different providers and institutions by bringing conventional and complementary approaches together to care for the whole person. There are 4 approaches to complementary health. The first, nutritional, includes things such as special diets, dietary supplements, herbs, and probiotics. The second, psychological, includes things such as mindfulness. A physical complementary health approach includes things such as massage and spinal manipulation. Combinations of complementary health approaches include things like yoga, tai chi, acupuncture, dance or art therapies, or psychological and nutrition like mindful eating. According to a 2012 national survey, many Americans, more than 30% of adults and about 12% of children, use healthcare approaches that are not typically part of conventional medical care or that may have origins outside of usual Western practice. Natural products include dietary supplements other than vitamins and minerals. The most commonly used natural product was fish oil. Holistic health, otherwise known as whole person health, is a state of complete physical, mental, social, and spiritual well-being. Whole person health refers to helping individuals, families, communities, and populations improve and restore their health in multiple interconnected domains: biological, behavior, social, environmental, rather than just treating disease. 7 core areas of health have been identified in integrative health settings: sleep, movement, nutrition, relationships, resiliency, spirituality, and environment. We're going to talk about these briefly in the upcoming slides and in more detail in upcoming weeks. Sleep. Getting consistent, adequate, and restful sleep is optimal for well-being. Sleep impacts all aspects of our mental, physical, emotional, social, and spiritual selves. Movement. Regular physical activity helps improve overall health and wellness while reducing risk for many chronic diseases. Nutrition. Nutrition involves eating whole, non-processed foods. Evidence shows that cultures around the world that consume whole, non-processed food are healthier. Relationships. It is important to interact respectfully with others and self. Healthy socializing and relationships are essential to healthy living. As social beings, studies show that we live longer, are healthier and happier when we are with those that we love and share our lives with. Resiliency. Resiliency involves practice stress protective activities. As we address our stress, have fun, practice relaxation, and use healthy coping skills, we build our resilience to future stress and avoid the harm stress can incur. Spirituality involves values and beliefs about ourselves and the world. It involves acknowledging and honoring the role of spirituality, or the purpose and meaning in our health, what we do in life, and as well as how and why we do it. I heard an interesting quote about spirituality on a podcast the other day. It said that religion is for people that want to avoid hell, and spirituality is for people that have already been there. Environment. Environment is engaging in our physical surroundings. The emphasis of interconnectivity reminds us that if our internal or external environment is out of balance, we are out of balance. Why integrative health? As you can see from this chart here, the United States spends more for healthcare than any other developed country. The United States spends nearly 18% of gross domestic product on healthcare. Despite this, we have some of the worst outcomes for common health metrics, such as life expectancy, infant mortality, obesity, and unmanaged diabetes. Contributing factors to healthcare cost are cost associated with high-tech medicine, privatization of for-profit healthcare, high cost of malpractice litigation, millions of uninsured children and adults, an unwillingness or inability of many to take personal responsibility for their health, other socio-economic and environmental factors that prevent access to healthier lifestyle options. In the United States, the disease-oriented healthcare model is fiscally unsustainable. Failure to focus on health care rather than disease care for preventable causes of disease has created a system of healthcare that is exorbitantly expensive, fails to provide equal and universal access to healthcare, and which has led to significant dissatisfaction among providers and patients. Most deaths in the United States are due to unhealthy lifestyles. Due to cost and access, more Americans are seeking non-conventional medicine. Medicine has been moving towards a more holistic, patient-centered approach. Most deaths in the United States are due to unhealthy lifestyles. Many cancers are related to modifiable risk. Due to cost and access, more Americans are seeking non-conventional medicine. Medicine has been moving towards a more holistic, patient-centered approach. History of integrative health in the United States, from the time period of 1492 to about 1942. Native Americans' remedies were effective. Native Americans believed in something called the law of correspondence, which held that remedies could be found in the same locales where diseases occurred. Dr. Benjamin Rush who also signed the Declaration of Independence, recommended colonists grow their own medicinal plant gardens because he did not trust the apothecaries. As folks migrated out to the Wild West, there were no doctors available, so they relied on nature for cures. During the Civil War, Union soldiers blocked access to medicines, so Confederate soldiers began to rely on natural remedies such as lavender. After the war, with the advent of medical insurance, more hospitals were built and therefore there was more reliance on medicines and surgeries. In 1993, the National Institutes of Health established the Office of Complementary and Alternative Medicine to support research on a variety of complementary medicine treatment approaches with an initial budget of $2 million. In 1998, the National Institute of Health renamed and expanded the Office of Complementary Medicine to the National Center for Complementary and Alternative Medicine, and the budget was increased to $110 million. In 2014, this agency was renamed the National Center for Complementary and Integrative Health. In 1994, Andrew Weil established the program in integrative medicine at the University of Arizona in Tucson, establishing the first formal academic medical fellowship in the emerging field of integrative medicine. In 2019, the center was renamed the Andrew Weil Center for Integrative Medicine. The Institute of Medicine, now renamed the National Academy of Medicine, held an Integrative Medicine and the Health of the Public Summit in 2009. The Institute of Medicine moved toward integrative health with a focus on a team approach to care. The former president of the Institute of Medicine proposed 5 dimensions of integrative medicine. On this slide are the 5 dimensions of integrative health that were proposed at that summit. Number 1, broad definition of health. Integrative medicine offers the possibility to fulfill the long-standing World Health Organization definition of health as more than the absence of disease. It should include physical, mental, emotional, and spiritual factors, enabling a comprehensive understanding of what makes a person healthy. Number 2, wide range of interventions. Integrative medicine encompasses the whole spectrum of health interventions, from prevention to treatment to rehabilitation and recovery. Number 3, coordination of care. Integrative medicine emphasizes coordination of care across an array of caregivers and institutions. Number 4, patient-centered care. Integrative medicine integrates services around and within the individual patient, which is perhaps the most fundamental and the most neglected aspect of high-quality care. Number 5, variety of modalities. Integrative medicine is open to multiple modalities of care, not just usual care, but also unconventional care that helps patients manage, maintain, and restore health. Since 2009, support for the integrative health has grown. Many academic institutions now incorporate principles and practices of integrative health within their curriculums. I'd like you to think about the questions on this slide. This is a self-reflection exercise. It's not something you need to turn in, but I just encourage you to write your responses on note paper and then look at them when this class is over to see if anything has changed. As part of your education, I challenge you to critically look at your approach to healthcare and well-being. Consider the following questions. How much on your time is spent focusing on disease? How much time do you devote to actively promoting wellness? Do you have time to get to know your patients? Are you encouraged to see each patient as a whole person? Do you work with your patients to support healing on every level? Mind, body, spirit? How can you best promote a more effective and integrative approach to health at the level of the family, community, and society? I want you to also think about, how do you define health in your own life? And what does it mean to be healthy to you? These were the references that were utilized for this Integrative Health lecture. Thank you for listening.